So this one's going to be pretty brief. It's just talking about the selection of materials. We already talked a lot about how to create quizzes and what information you needed to select the most appropriate quiz questions and things like that. So I'm going to keep this pretty brief in just a selection of audiovisual materials and textbooks mostly. So you need to be able to distinguish between high and low quality teaching and learning resources. You want to describe the uses, benefits, and potential drawbacks of using audiovisual material in teaching, and use the principles described to choose and utilize the appropriate educational materials and media like textbooks. So there are many types of materials, media, equipment, and other resources available in EMS education, and you must understand them in terms of their intended purposes, advantages, disadvantages, and limitations. So a textbook itself is not a curriculum. It's an adjunct that helps you implement your curriculum. And so when I'm setting up a course with the Office of EMS, there is a prescribed type of material, amount of material that needs to be covered, and an appropriate amount of time that is to be spent on each topic. And that's the same for each class, regardless of certification level. And so there are a variety of textbooks on the market, and we're going to talk about some things to consider when you're choosing one, but they do not provide that material for you. All they do is give you, hey, here's a textbook and it covers this material, but you have to utilize that to create your curriculum, to know what you're going to teach and how to incorporate that textbook and the textbook resources into it, but also how to utilize things outside of that. So when you are selecting a textbook, you want to consider the breadth and depth of some content areas and if that's applicable to your students, because some textbooks go really in depth and some are very brief. Some have a lot of pictures, some don't have any at all. So it's really important that you choose a textbook that's fitting for your type of student, who your target audience is, and how you're going to utilize that. I myself prefer plain text, so writing that is easy to understand and also that has pictures, case studies, graphs, things that they can use and take more than just the words on a page to read and look at. So we want to select a text with a writing style that engages the reader and avoids bias. We want to look for clear, organized, efficiently presented material. You can consider a text that also has an ebook option, because there are some students who prefer that. And consider the reading level. And so things that you want to do to look at reading level are going to be sentence length, paragraph length, syllables per word, sentence structure. Is it easy to read or not? So the average American reads at a 6th to 8th grade level. And so the North Carolina Office of EMS requirement for EMT is an 11th grade reading level, and for AEMT and paramedic, it is post-secondary, meaning college level. However, if a student has a high school diploma, they don't ask them to take a reading test. They will accept that high school diploma or a transcript saying that they completed an 11th grade English. That doesn't necessarily mean they have to take the test to prove that they can. So they very well could be reading on an 8th grade level if it's been, 10, 20 years since they've been in high school, and they've kind of lost some of that reading. If they're not using it, they're losing it, right? Looking at training equipment and supplies, we want to consider the quantity of supplies and equipment needed. So ideally, when we're planning for lab instructor ratios, we want to do 1 instructor to 5 students at max. Now, that really depends on what's happening inside of your classroom, because I can demonstrate a skill for around 20 students. But if I'm actively checking them off and I'm engaging with them, then I want to work in about groups of 5 or less. So consider the size of the classroom and the available space that you have to be able to break students up and work in these smaller groups. And we want to make sure we're using equipment that is representative of what is currently being used in the field. And that's very difficult sometimes, because we simply can't do that with the budget that a lot of us are afforded, especially in the community college system. We are on a very limited state budget. We have to go through a huge approval process to get new equipment. And so we do the best that we can, but it's very important that we maintain our equipment, that we take good care of what we have. And sometimes that means having to borrow it or work with other healthcare programs like nursing or like radiography, or working with your local EMS agencies to utilize some of their equipment. And I'll use stretchers for an example here. We do not have any type of capability to demonstrate an electric load stretcher for our students with the way that is now. So we often rely on our local EMS agencies to come and demonstrate that for students so that they get the opportunity to see that before going to clinicals. And we still teach them the way to lift and load a manual stretcher, but seeing that electric load is very important to them because that's relevant to what they will see in a clinical setting, but it's not something that we can afford to have at the college itself. So just considering having the most updated equipment. Now you have to also abide by regulations. So when was the last time you guys used a combi tube, right? Like that was the only tube available for blind insertion when I first went through EMT back in 2007. But now we have several on the market, and most people do not use combi tubes, but it's still a national registry checkoff skill, which means that we have got to be able to teach students how to utilize them so that they can be proficient in all areas, even though that's not something that they would normally see. Looking at audio-visual adjuncts, a PowerPoint presentation is only one option for an audio-visual adjunct. So generally, these PowerPoints are provided as a resource with your textbook, but consider elaborating on them or making your own. And so most textbook manufacturers will provide PowerPoints, one if not two sets of PowerPoints to go along with your learning material, but they're often kind of vague, and so either you need to elaborate on those while you're talking about them in class, or you need to add more material onto them to be able to elaborate in I lost my train of thought, to elaborate on them, like how I've done with you guys here by adding more material here. The NAMSI does not provide PowerPoint, so I have to take the material out of their textbook and create my own PowerPoints, which you have the option to do as well. And that was actually one of the best pieces of advice that I got from our educational leader for the Office of EMS, Mr. Todd Messer, a few years ago, who told me that rather than committing to one textbook or one type of material, to just take the material and create my own. And so I have been working on doing that for the last several years, but it's a lot to undertake to do that for every chapter. So I still do utilize some textbook PowerPoints, but I'm working on making all my own as well. So some tips for making PowerPoints: a dark background with light text tends to increase visibility of that text. You don't want to overcrowd your slides, but also elaborate as needed to keep the concepts and ideas intact. Build questions or scenarios for interactivity throughout the lesson plan. Stop midway through a PowerPoint, switch it up, show a video, or ask a question, or give a pop quiz or something. You can usually keep a student's attention for around 20 minutes, and we talked about this on the first day, before you need to switch it up and do something new, even if it's just changing the background color of your PowerPoint. Make sure you're using graphics and pictures that enhance the slides or that you can elaborate on with discussion. So a lot of times what I like to do is give one picture and say that that's my patient, and then I would ask the students, based off of what you see right here, how would you treat them, or what would be your next step? We want to consider using videos, websites, and scenarios. So marker boards are really great as well. They are great for spontaneous and dynamic activities. I have a set of small boards that I got from the dollar store, so I have around 10 of those. And so if I have more than 10 students in a class, I'll break them up into pairs or small groups and give them markers, and I'll ask questions. And this is a really easy way for them to engage because there's no fear of getting it wrong. They're not shouting out their answer. You're not calling on them individually. They feel safe to get an answer wrong. And then fill in the blank or games on a large board. So your big board up in the front of the classroom, I like to create, I usually do this for pharmacology and drug cards. So what I'll do is actually create some columns and rows, and I'll list the medications that I want to be named, and then I'll list what I want to know about each medication, and then I'll break the class up into 2 teams. And so I'll say red team, blue team, give them corresponding markers, and I'll give them the opportunity to go up and fill in the information. And then at the end, they have to go up one by one, and at the end, when the whole board is full, whoever got the most correct answers, red team or blue, I might give them, a couple points extra credit on a quiz or test or a piece of candy or whatever it is, just to give them, again, a little reward for doing that. And they really enjoy that. So YouTube is a really great resource for scenarios and skill demonstration, but make sure you've watched the full video and know the information provided is what you want your students to learn. Patient assessment is one of those things that can be really varied if you're looking for YouTube videos, even if it's National Registry based. So just make sure that you're comfortable with whatever is in the video if the student were to emulate that. And then times to use audio clips. I really like to do this for lung sounds, and another example would be for radio communication. So finding reputable websites that can play those audio clips for you that you can show in class. So that's going to be it for the selection of your material. And again, if you guys have any questions about anything we talked about this week, please feel free to reach out and let me know.